Dr. Sarah, welcome to the podcast.
Thank you so much for having me. I'm really excited to be here.
I'm so excited for this conversation. You and I have known each other for quite some time. And as we were just kind of dialoguing before we hit record, I was saying that I get so excited whenever I see a post from you on social media or, just something that you're doing in this world because I think you're such a beautiful human being. And I've really, really appreciated seeing your own personal mission evolve over the last year or so. So I'd love for you to share with the audience, who you are and what you do, but I think more importantly, what is your mission in the world and really how did you get here?
Sure. So it's interesting because I think the way that I would normally answer, who am I would go straight into my work, which is, I think, what most of us do. So I'm trained as a naturopathic doctor. That's my day job. That's what I do every day. However, what I've realized, in the past year or so, kind of what's become really clear to me is who I am is a woman with a voice and who's now using that voice to help other women find their own voice. And that's really something that I'm quite passionate about. And so when we talk about journey, we were talking about this a few moments ago. Now that I have clarity on that being who I am and what I do, it's amazing how so many pieces of my life now seem to have happened to like bring me to this exact moment. So just as a quick example, when I was a kid and we had to do a presentation in front of the class, whereas most kids hated that, I was the kid who thrived in front of the class. I was the kid who loved to get up and do her oral presentation. And I was a child of the 80s, so we didn't have PowerPoint, we had Bristol boards. I would spend
Love that.
hours preparing these like beautiful Bristol boards. And I love that. And I still do. Like, I love speaking, to small groups, larger groups of women. Like, it's really where I think I shine. And so it's so interesting that it's taken me 38 years to piece it all together. But I'm like, my voice is my gift. Like,
Mm,
looking back now, it's been so obvious throughout my life that that's something I've had that just came so naturally that I didn't think was anything special because it was just something that, I kind of had. And now that I'm older and wiser and just seeing how that really is a gift that I have that I'm now so privileged to be able to use in my work to help, to help other women.
and I love, I mean, you and I know each other. I know you know my work as well. And I get super excited when I have the opportunity to have conversations with other female leaders about their journey and their story and how it is that they came to find their own voice. So it's very, very interesting that your, day job, as you call it, naturopathic doctor. I know you've specialized in thyroid health. So I've always been interested in your work. I've, had a low thyroid. I've struggled with my thyroid since I was in my 20s when it was diagnosed, got, way out of whack when I was pregnant with my daughter. And so I've always been very interested in what you do. And lately, as I've watched you find your own voice and really weaved in this idea of helping other women find their voice, I've become that much more fascinated and interested in what you do. Can you share a little bit if you're open to? I'm always curious, what are some of the parts of your own story that have really led you here, right? Like what is it about, Sarah's story and sort of your own narrative and your own experiences that have really allowed you to value the importance and really what it means to find our voice?
Mhm. So there's a couple pieces I'll share. The first is that I've always been outspoken in some areas of my life. Like I said, public speaking for me is easy. I love it. Sharing my opinion generally pretty easy. But there are other areas in my life, in my relationship with my significant other, for example, or sometimes with my parents, where I found it much harder to use my voice.
Mm,
And so there was really a pivotal moment this past summer where I realized that some of the physical symptoms that I had been dealing with for years were related to grief and to a specific event, which I'm happy to talk about. And so I'd been dealing with chronic digestive issues, specifically bloating. And
Mm,
what was interesting about my bloating is that it always came with anger.
mm,
Whenever I was bloated, I was angry. And I was like, that's just really interesting. I never really understood why. And so I tried all the diet changes, all the supplements, all the things that I have in my naturopathic toolkit to deal with this bloating. And it always ended up coming back.
mm,
And so this summer, I was walking with a close friend who actually has training in theater, and she was telling me that one of her teachers in school taught her that our lower abdominal section, like our digestive system, he referred it as it to the swamp. And he
mm.
was saying this is where we put all of our emotional baggage. It's where we carry a lot of traumas and griefs and things like that. And the second she said that, I knew exactly what my bloating was about.
You
It was
did.
totally an emotional thing that I had been holding on to. And so in that moment, I decided that I needed to use my voice to share that particular story. And when I did share that story, the first time I told that story, I broke down. I sobbed through telling the story, and I'll share what the story is in a moment. Um, but afterwards, I literally felt like I had shed 30 pounds. Like
Mm,
I went for a walk later that evening, and like the weight that had been lifted off my shoulders was incredible. And so that was the first really clear insight I had into the connection of the importance of telling our stories and releasing some of the things that we hold inside of us, and the almost immediate impact that it can have on our physiology, whether it's your thyroid, your mood, your bloating. And so from there, I continued to share this story. And now, it's still an emotional story, but it doesn't carry the heaviness and the weight that it did when I was holding it inside of me and trying to carry all of it myself. And my bloating is significantly better. It's not that I never get bloated. Yes, it still happens, but there isn't that anger. There isn't that emotional piece attached to it. And so that was kind of what I realized over the past year, the power of using our voice to reclaim our health, and the really intimate connection that we have between our stories and our past and our history, and how we choose to articulate that, and then how that then reflects in our health.
This is so, so powerful, and it really causes me to think about this concept that, in my not so distant past life as a psychotherapist, and in my work, even, with my clinical team, this idea that, our body keeps the score. Like our body knows what we're carrying, whether we are consciously admitting it or not, whether we are consciously dealing with it or not, our body is always trying to process those past traumas, those past experiences, those really difficult areas in our life. And they continue to come up for us, right? Until often, for so many of the women that I've worked with, it's like until our body's like literally screaming at us and saying, you have to pay attention to this.
Mhm.
This is really important, right? And so often we don't pay attention to those inner screams because there's often shame associated with it. Like that's the number one emotion that I would say in my work, that is the number one emotion that will keep women from paying attention to their voice, to their narrative, their experiences, their trauma, their story, whatever that thing is that we're feeling inside of us. It's often shame that really does get in the way.
Yeah, I absolutely agree. And I refer to this as our inner voice. To me, our inner voice, the other way to think about it is your intuition.
Mm,
It's those quiet whispers that come to tell you what your body likes and what it doesn't like, right?
Mm.
It's the little gentle signals. It could be mood, it could be headaches, it could be, digestive stuff, but it's all of those little whispers that your body is continuously kind of sending to you to say, yes, do more of that, or
Mm.
no, I don't like that. I want you to do less of that.
Mhm.
The problem is we have so much internal noise, which is our ego, which is the
Yes.
loud inner voice, which talks loudly and unkindly to us all the time. And until we can learn how to create space to quiet the ego,
Mm.
let alone all of the external noise that we're surrounded with, it's very hard to hear the whispers.
Mhm.
And that's why most of us don't hear the whispers, or we ignore the whispers until it starts to scream, until we have something significant that happens, whether it's like a marriage breakdown or your thyroid all of a sudden stops working or something else pretty dramatic happens. That's often when we start to listen. So a big part of what I am teaching my patients and part of the work that I do in my programs is let's start to listen to the whispers, because that's where all the wisdom is. Our bodies are incredibly wise and insightful, and they have all of the answers that we probably will ever need, but we're so disconnected from that part of ourselves because we live in a society that's very brain-based. We're all so cerebral. We live in our heads. And, here's the newsflash: your intuition isn't in your brain.
Mm.
It's probably
Right.
in your body. It could be in your gut. We talk about gut feelings all the time. For some people, it's more of like a heart feeling. So until we learn to drop out of our heads for a quick second and reconnect with our body and create some quiet time for those whispers to be heard, we're not really listening to that inner wisdom.
And as I hear you talk about that, Sarah, I can't help but just to like imagine that process, right? Like dropping out of my head, dropping into my body, really paying attention to what's going there and what's going on inside there. And I can't help but think, that that's scary, right? Like I know times in my own life where I've been invited to slow down and really pay attention to what's going on inside. Like, what is this tightness in my chest? What is this like heaviness that I'm feeling, on my shoulders? Or, what is this like turmoil I'm feeling inside of my stomach?
Mhm.
That it's fear often, I think, that kind of gets in the way, right? It's scary to think about really paying attention to what's going on inside of us,
Yeah.
and I wonder if that might have been even for you a part of your journey, right? Is really looking at that, overcoming that, leaning into those difficult places so that you could find your voice in such a powerful way that you're able to then support other women in finding theirs.
Yeah. There's a ton of fear associated with this, right? There's a fear of loss. There's a fear of losing your people who support you, right? There's this fear of abandonment, that if you come out and start saying exactly what you think and feel, some people are not going to like that. And that is a real fear that we need to acknowledge and that we need to kind of help guide women through. But the flip side of that is that how sad and scary is it to live an entire life that is not authentic to what
Mm,
your body wants and needs? To me,
right.
it's far more scary to live a life that is not true to me than it is to listen to those whispers. And they're often scary. And one of the ways that I always like to talk about your intuition is your intuition will never talk to you in fear. Your
Mm,
intuition will not tell you, like, don't do that. Your intuition is always trying to move you toward something.
mm,
It doesn't mean that what it's moving you toward doesn't feel scary. But
right.
intuition itself is not the voice of fear. That is your ego. That the ego is the one
Right.
who's telling you, don't quit your job. How are you going to get money? Don't leave your relationship. What are you going to do without him or her? Don't tell people what you really think. You're going to lose all of your friends. That's your ego. Your intuition, again, it's the quiet kind of gentle whispers that, make themselves heard. But they're always coming from a place of like guidance. So that's one of the ways I always like to differentiate that. But yeah, it doesn't mean it's not scary. A lot of the stuff that our intuition tells us is very scary. So I'm happy to share kind of my story and my experience. So in that moment when I was walking with my girlfriend and she talked about this swamp, and right away I knew that part of what had been causing my chronic bloating was a story that I had been carrying secretly for a couple of years, which was that I had had an abortion a couple of years ago. So when my son was 2 years old, I found out that I was pregnant. It was unplanned. And my partner and I had decided that we were very happy with our family of three, and we weren't planning to have any more children. And so when I saw that positive pregnancy test, I was surprised and a bit shocked. And I came home and told my partner, and he very quickly made it clear that he did not want more children, as we had already talked about. And so after many weeks of conversation and really thinking about it, we decided, and I decided, that we were going to terminate that pregnancy, which we did. And it was the hardest decision I've made in my life, and the kind of several months that followed it were incredibly difficult. And I'll share kind of two reasons why they were difficult.
Mm-hmm.
The first one is that I blamed my partner for that decision.
Mm,
And the reason I blamed him is that before I told him about the pregnancy, I didn't give myself enough time to decide how I felt about it.
interesting.
I didn't tap into my intuition and decide, how do I feel about this pregnancy before I let in the noise, which in this case was, my partner. And not that I want to say partners are noisy, but it's outside, it's an external opinion.
Yes.
And so it took me a long time to figure that out. So for months, I was angry with him. It was a huge strain on our relationship, because I had a lot of resentment towards the decision that I had made. And so now in hindsight, I can actually look at this and see it as a really big and difficult lesson, but an important lesson, that no matter what kind of decision you're dealing with, I think it's vitally important, especially as women, that you decide how you feel about something before you go out and you ask for other people's opinions. Because I think if you're not clear on what you want and you let other people bring in their opinions and things, it's going to be really difficult for you to end up knowing what your actual opinion was.
That was so powerful. Like I almost wanted to interrupt you. I mean, I think that's such an incredibly transformative, massive nugget of wisdom right there.
Mhm.
Right? Is to actually allow yourself to really sit with, how do I feel about this?
Mhm.
What are my needs in this? What do I think of it? What's my opinion even
Yeah.
in this matter, right? Before bringing in external circumstance or opinions.
Mhm.
And I can imagine in this very, very vulnerable story that you just shared, it would have been very natural for you to immediately turn to your partner,
Mhm. Yeah.
right? That would have been a very natural, you learn this information. Of course, I'm going to immediately share it with my partner without even pausing to
Mhm.
really, I can sort of imagine that moment. You look at that pregnancy test without really processing what that means to you.
Yeah. Yeah. So that was a huge lesson learned from that from that very difficult experience. The other thing that was really kind of insightful again from that experience was to it helped me realize how I wasn't using my voice in this particular relationship. So
Mm,
again, after I had the abortion, I was grieving. I was very sad. I like literally cried myself to sleep for months.
mm,
And it's not because I regretted my decision. In hindsight, it was the right decision for me and my family, but it doesn't mean it didn't come with enormous pain and grief and sadness. Um, but having said that, in that grief and sadness, I was so unable to articulate what I needed from my partner.
mm.
And he did not know how to support me in that. And so that's
Right.
also part of what made a difficult experience more difficult, is that for months after, I felt so alone.
Mm,
Because I wasn't telling anyone about this experience, I didn't tell any friends, I didn't tell anybody else. I was literally carrying it by myself. And my
mm,
partner, who was the only other person who knew, he didn't know how to help me in that particular time. And I was unable to articulate it. So that was another really important lesson from this experience is the importance of being able to tell your partner, or, any other person that you need support from, like, number one, here's how I'm feeling.
Yeah.
And number two, here is what I need from you to help me
Mhm.
get through this right now.
Mhm.
And
Mhm.
so that was a really important relationship lesson that I took, that, it's lovely that we want our partners to know what we need at all times. And sometimes that's true. In this case, that was not true in my relationship. So it just reaffirmed how important it is, again, for us to use our voice to get whatever it is that we need in different situations.
Yeah, I'm so grateful that, you decided to share that story with us today, really and truly. And I know we sort of dialogued around, what our conversation was going to look like today and where we're going to go. And that is, I would imagine, it's such a powerful example, Sarah, of so many pieces here, right? This piece around the communication, this piece around slowing down and listening to our own voice, and also this piece around um, how feelings of grief and pain and loss don't necessarily mean that we haven't made the decision that is right for us. And we often think that those difficult feelings are an indicator that we've made a mistake, or that
Mm,
we need to change course, or that, right, like it's somehow an indicator that, we're headed in the wrong direction. And what I'm hearing you say is that in that moment you really needed to process those emotions, right? Have that emotional experience, and you were also able to remind yourself that this was in fact the right decision for you and for your family.
mhm. Yeah. And I think that is a really important thing to know, because I think that applies in so many different decisions that we make as women, that even when it is the right decision, it doesn't mean it's going to be rainbows and unicorns the whole time. There could still be fear, there could be sadness, there could be all types of, what we call negative emotions, which, I don't feel there are any negative emotions. Um, so I was very lucky that I worked with a wonderful therapist throughout this experience. And that was one of the things that really stuck out that she said to me. She's like, just because it's right doesn't mean it's not hard. And I was
Yeah.
like, yes, that is exactly right. The other thing I'll share, in my experience in sharing this story now in a few different kind of contexts, is that I think it's also really important, as women who have a platform, to show vulnerability,
Mm,
because I think part of speaking your voice and telling your story is making yourself vulnerable, which is
yes,
something else that's very scary. And especially when we're talking about something which can be polarized, like abortion,
absolutely.
it's very easy to want to hide and to not share and to keep it to yourself, because that is, it's safer in a way. But
Yes.
what I can tell you in sharing this story is that the way that it has been received by the women that I've shared it with has been incredible. Everyone has been so kind and loving, and just very accepting. And whether or not they're, pro-life or pro-choice, like, that doesn't enter the conversation in this
Hmm.
particular case. They're just, they have mentioned so many times how much they appreciate and admire my ability to be vulnerable, because it then allows other women to be vulnerable. And so that's a big reason why I share this story. Number one, because I think we need to talk about abortion more openly, because it's something a lot of women experience and that no one talks about. But also because I think it's important, as someone who has a little bit of a platform, to be vulnerable, to show them that I can talk about this stuff and not just survive it, but literally thrive in the telling of this story. I can tell you 100% that I am better off physically, mentally, and emotionally from sharing this story than I am when I was carrying it around as this literally like weight in my gut. So, whatever your story is, I really encourage women to find a place that feels safe for you to start, but just to start having these conversations and sharing our stories, because I do believe it's one of the most healing things that we can do for our health, is to start to share some of our stories.
I could not agree with you more. And, as I was listening, and we're recording on video, right? That'll be released on the podcast, but we're recording on video. And as I was watching you share your story, I could see the emotion coming up. Like I could see that this is still difficult to talk about. This is still hard that I could see you self-regulating as you were telling the story, right? I could see you breathing through it. And I think for me, it's just another reminder that just because something is difficult, just because sharing something is hard, or just because a conversation is uncomfortable, really doesn't mean that we shouldn't do it. And in fact, right, like one of the questions that I love to ask on this podcast, and one of the things I love to talk about is, how do you lean in to those difficult areas, and as I was watching you, that was a question that came to mind for me. Is this is obviously still very difficult for you to share, right? I can see the emotion, I can hear the emotion. And so what is your strategy? What do you do when you know that you need to say something, you need to use your voice, and it's going to be difficult, and it's going to be painful, and those emotions are going to come up? What do you do? How do you do that?
Yeah, a big part of what I do is I remind myself that it's always better out than in.
I like that.
It's simple. So, the story I just gave is one example, but I think we can all think of a time where you have something that you like are dying to say and it's literally caught in your throat. You feel uncomfortable. Maybe your heart is racing. You have a pit in your stomach. Think about what that is doing when you are holding that in over years or decades, and then multiply that by the number of things that you are not saying.
Yes.
So that's how I now have started to think about it, that I literally like I feel that I need to say something and I coach myself through it. Like this happened on the weekend, like something super simple that I wanted to
Mhm.
tell my partner about, and I didn't know how he was going to respond. And I was literally, we were walking, I was coaching myself, like, just say it, like, get it out,
Mhm.
get it out. And I did, and it was nothing.
Mhm.
So that's one
Mhm.
of the things that I remind myself, that even if it is poorly received by the other person, I can almost guarantee that you're going to feel better having said it than holding it in. And I've had so many reminders of this. So that's one of the things. Just like it's better out than in would be
And
my
if we could, I want to pause on something you said because it's so important. You just said that even if it is poorly received, it is still so important, so valuable, so needed that we share it. And one of the things I will say, until I don't know, I'll just keep saying this over and over and over again to the women that I work with, is that despite the fact that it probably will be poorly received, because
Mhm,
often when we begin to use our voice and we begin to share our thoughts and our feelings and our needs, it's might be inconvenient for others.
mhm.
It might be
Yes.
highly inconvenient, and they really may not like this new assertive vocal version of who we are. And often it's not well received.
Mhm.
And it might not be well received the first 10 times you begin to use your voice. But don't let that stop you. I think
Yes.
for so long, like even for me, that's what stopped me from using my voice, was how was this other person going to react? Was I going to make this other person uncomfortable?
Mhm,
Was I going to inconvenience this other person over here? And
mhm.
that was enough to stop me from sharing anything.
Yeah. Because we've all been conditioned to be nice. What
Yes.
is the number one thing we tell little girls, or
Hmm.
encourage them to be, is nice.
Yes.
Being nice is not necessarily encouraging you to use your voice or to speak your
Absolutely.
truth. It's encouraging you to be quiet and to be agreeable, to not ruffle any feathers, and please, please, please do not hurt anyone's feelings, no matter
Yes.
what.
Right.
And so, of course, we're terrified to start saying things that people might not like. However, one of the books that I read in the past year that has been a game changer for me is the book Untamed by Glennon
Mm.
Doyle. And one of the things that she says in there that I share all the time, specifically in this work, is that if you have a choice between hurting yourself and hurting someone else,
Mm.
you have to pick the other person every time.
Wow.
And that is really scary for most women, to think about hurting somebody else.
Sarah, it's the exact opposite of how we've been raised.
Of course it
The
is.
exact opposite.
I know. And so I think that that is important, just even to ponder as a concept, because what I just said probably hurt your heart and your brain at the same time. But the reason it's important to be comfortable and to get comfortable disappointing other people is that if you're not doing that, it means you're disappointing yourself.
Yes.
And
Hmm.
most of us are disappointing ourselves over and over and over. And then we wonder, why am I not really happy?
Yeah.
Why do I have anxiety? Why do I have depression? Why does my body feel tired and sluggish all the time? Because it's responding to decades of you letting yourself down and disappointing yourself in order to keep everybody else around you happy. And that is not a recipe for good health, mental, physical, emotional, or otherwise.
I love this. I mean, I'm just like jumping out of my skin here. This is resonating so deeply. And I imagine like we had a bunch of questions, guys, and like totally didn't get to any of them because everything you're sharing is just so, so important, I think. But I imagine that this for you was the missing piece or the missing link to thyroid health,
Yeah, it
right?
was. Yeah. So I've built a very like busy and successful practice treating women with thyroid conditions, and I love it because it's a condition that in my opinion is not always very well managed in the conventional system. I think there's a lot more we could be doing for women with thyroid conditions than just giving them a medication and saying, take it for the rest of your life and see you later. Medication is a very important part of your treatment, but it's just one small part of the treatment. And so for 10 years, I've been working with women on all the other pieces. But there was always something missing in it for me.
Mm,
And that's because I, knock on wood, personally have not had thyroid issues to this date.
mm,
And so, as much as I loved it, it always felt like something was missing. And then within the past year, I started to make the connection with the help of some really wonderful colleagues who were like, it's so obvious to us that this is the link, it's the voice.
mm,
And so once I started to bring this piece into it, and now that I'm kind of guiding women more on specifically on helping them find their voice, it's all come together. And the reason I think it's so important is that when we look at what is preventing women from having good health, it's not a lack of information.
mm.
You can go online and you can Google all kinds of things about your thyroid, and you could know, a lot of information. We don't need information. We need people who are taking action.
Mm,
And one of the reasons why women often don't take action is because their life is not supportive of their health. They
mm.
often don't have great boundaries. They are not great at telling people what they need and want. And so when they get up every day and they look at their day, none of it or very little of it is in there for them or by them.
Yes.
Right? So we're going through these days which are filled with, to-dos and commitments that are for other people. And then we get to the end of the day, we're so tired. There's no time for us to do anything that would be for us or that we've chosen to do. And then again, we wonder why we have chronic health concerns or again, why we're
Mm,
tired all the time. So for me, using your voice is one of the most powerful things you can do for your health because number one, it reconnects you to your body.
mm.
Again, reconnecting you to this inner voice or intuition, which is going to tell you what you need to do to take care of yourself. Right. But most of us, again, we're completely disconnected from that. So number one is reconnecting to your inner voice. Once you know what that voice is trying to tell you, you want to try to match that with what you're doing during the day. So part of what I have women do in my program is I literally have them track, what are you doing like in 30-minute chunks over the span of the day?
Mm,
And from there, we can start to see, well, this is what my body is asking for, and this is what I would like. but my day looks nothing like that. It's a
Right.
complete mismatch. And
Right.
so once you have that inner voice guiding you, and we teach women how to start using their outer voice, we can start putting in boundaries. We can start articulating, these are the things that I need and I want in order for me to feel good, in order for my needs to be met, and in order for me to have good health. And
Right.
that's why I think it's so powerful. It's not that we need, more people, with more information. We need women who are clear on what they want internally and then are able to articulate that, in a way that is meaningful for them.
I love it. Like I don't think I have ever heard anyone make this connection when it comes to women's health, right? With our intuition, the assertiveness piece, which you know that I was going to be all over that, right? Like like for sure I was going to be all over, any way that we can begin to re-educate women around assertiveness and asking for our needs and really showing up differently, first and foremost for ourselves and then for, everybody else. I absolutely love it. I think it's so fascinating. I have no doubt that my audience is going to find this conversation incredibly useful and also find the unique angle that you bring to women's health very, very useful. Dr. Sarah, where can my audience go to find you? Where are some of the places that you hang out, where you're sharing your wisdom, and where can they connect with you?
Yeah, so you can find me on Instagram at Sarah Vadeboncoeur, and I'm sure Shyamala will provide the spelling for that for everybody. And then you can also visit me and learn more about some of the programs I offer on my website, which is www.docereclinic.ca. And that's where you can learn about my one-on-one practice as well as the programs that I offer.
Amazing. Dr. Sarah, thank you so much.
Thank you for having me.